Good morning and welcome to CityLine. It's great to be in your home. This morning is a beautiful sunny Thursday morning, May 3rd, and we have a wonderful hour ahead of us. Later on in the hour, we'll be talking with the Tacoma Refugee Choir. They are back and they'll be talking about what they have been doing since we last were introduced to them. And they have a concert coming up here on May 12th that you don't want to miss. And then May is Hunger Awareness Month, and it's the food carrier drive. So we have Michelle and Kevin and Tawana here to talk about how you can get involved in the food carrier drive and even a hunger walk coming up, so you don't want to miss that. And then police recruiting is happening. We have Officer Shelby and Officer Stephen here to talk about their tenure on the Tacoma Police Department and what it's like to be a Tacoma police officer, and some stories you'll hear. Going to be a great segment. And then with me right now, in addition to May being Hunger Month, it is also May is Stroke Month and understanding the symptoms and signs of a stroke. So please join me in welcoming Dr. Dennis Wang. You are a neurologist at CHI Franciscan Health. Welcome, my dear.
Oh, thank you. I'm very happy to be here.
Good to have you on the big old comfy couch, as we say.
It is very comfortable.
It is comfy. So let's get into this. So May is American Stroke Month, and you've given me permission to call you Dennis as opposed to Dr. Wang the whole time. So let's just kind of recap. What is a stroke?
Well, very generally defined, a stroke is any sudden malfunction of your brain due to an abnormality of blood flow. And it's usually due to a blood clot blocking blood flow to an area of your brain.
There it is. Very, very simple. Doesn't get any more simple than that. So how prevalent is this in this day and age?
Well, you know, unfortunately, I think we all know somebody who has had a stroke. And they say that stroke, at least here in Washington State, is the number 6 killer of people. But it's not just the number 6 killer. If you survive a stroke, it still has a very long and lasting impact on people and their families.
Yeah, boy, it sure does. So blood pressure and stroke are related, and that's not new information, but there are some new discoveries about it. Can you share more with us?
Yeah, well, you know, having high blood pressure is not good for anything. But certainly it is one of the top risk factors for stroke. And even more importantly, high blood pressure is something that hopefully we can prevent.
Yes.
So recently they've changed the criteria for having high blood pressure. They've made it so more people are defined as having blood pressure by lowering the criteria for having it. So nowadays we say 130 or 80. If the top number of your blood pressure is 130 or above, you have high blood pressure.
There it is. Very simple. Cut and dried.
In fact, I think they say now that almost half of us would qualify as having high blood pressure.
You know, next time you come on, we're going to get a little blood pressure cuff, okay? We're going to take our blood pressure together. So here we have what we call the blood pressure chart. The American Heart Association and the American College of Cardiology. This is the updated blood pressure guidelines. And so we're looking at the 130 over 80 on this, absolutely. So, and then 130 is too high. So to know where we stand. So what are the symptoms of high blood pressure we should look for, let's say, you know, just in our everyday lives?
Well, you know, that's the thing, and that's why having high blood pressure is so dangerous. There really oftentimes are no symptoms of having high blood pressure, and most of us walk around not even knowing it. So it's important to get your blood pressure checked at some point, and if you do wind up having high blood pressure, or the high number being 130 or above, it's important to contact your doctor or get further assistance.
Yeah, I can see that. So you've contacted your doctor, you've walked in and maybe gone into one of the grocery stores, and your blood pressure is and you get a hold of your doctor. What should they do at that point?
Well, first it's important not to worry too much, because one number taken at one time doesn't necessarily mean you have high blood pressure.
Right.
So probably what the doctor will do is, number one, check it again in the office. But there's something called white coat syndrome, where people's blood pressure tends to be high in the doctor's office anyway because they're nervous.
Oh.
So it's important to get it checked a couple of times, and if it's always above 130, well, in that case then it might be time for some blood pressure medication to try to lower it to prevent your risk of having stroke or heart attack or anything.
What does family history play into this?
So, a lot of people ask me that. High blood pressure oftentimes runs in families. And as a result, if you have a mother or father or brother or sister that has high blood pressure, you have a higher chance of having high blood pressure too. And it's all the more important that you get yourself checked out as well.
Yeah. So we were talking in the green room about strokes and the history of me losing my sister at the age of 43 when she died from a stroke. And many people don't realize that there are treatments for a stroke. So let's talk about those treatments. What are they?
So you're right. These days we are fortunate in that we actually have some treatments that can deal with stroke. So if you think of a stroke as due to a blood clot blocking blood flow inside your head, there's two main ways we can deal with that now. The first is a medication that dissolves blood clots called TPA. And if you get to the hospital in time, they can give that to try to dissolve the blood clot. And then the second thing is we have tools now that can go through your blood vessels into your head to try to physically remove the blood clot. So I tell patients that if you think of a stroke like a clogged kitchen sink, think of the blood clot dissolving medication like liquid plumber.
Wow.
On the other hand, sometimes liquid plumber is just not going to get the job done, and you have to call an actual plumber. And sometimes patients have referred to me as the brain plumber. And so I have tools very similar, if you go to Home Depot, to what a plumber actually uses to open up pipes. I have similar tools to open up blood vessels inside the head.
Do not try this at home.
Well, don't try those Home Depot tools now.
No, absolutely not. So that is fascinating. So this ability to do what you do with the brain, is that new technology?
It is very, very new. So when I first started in 2009, the tools that we had were very, very primitive because as you can imagine, it's hard to get inside somebody's head to do anything at all. And so, stroke intervention or stroke therapy didn't really work that well. But just a few years ago, brand new tools came out. And these tools, you just had to use them once to realize they work much, much better than what we had before. So there's a lot of research now going on. There's a lot of publicity going on to try to tell people it's really important to get to the hospital because now we have even more treatments that might be able to help you.
So let's talk about those symptoms of a stroke because time is not on your side. If you are stroking or showing one of those symptoms or someone is observing you and going, I know the signs. I think we have a chart we're going to put up and do a little refresher here of the signs.
So you make a really important point, and that is that time is probably the most important factor in getting stroke therapy. You have to get to the hospital in time because as soon as a stroke starts, damage is being done. So we tell people the word FAST. It's an acronym, F-A-S-T, and it's on the screen right now. And basically, if you think you're having a stroke, you can go through this acronym. F stands for face. So you can look in a mirror or have somebody else look at you, and if you notice one side of your face drooping, that is a sign that you might be having a stroke. The other thing you can do is stick your arms out like you're Superman. And if you notice that one arm is drifting down or seems to be a little bit weak, that is a sign that you're having a stroke as well. And also, sometimes it's kind of hard because when you're having a stroke, you might not be able to realize that your speech is garbled, but try speaking. Try speaking to somebody else. And if they're telling you, you don't sound right, or you're having a lot of trouble getting words out, or you're just confused in general, you could also be having a stroke. And T is the answer. If you have any of those first three, it's time to call 911 because again, you don't have much time to spare.
Exactly. And it's, you're just taking me back to when my sister stroked and left a message on my machine, and my daughter said, "Mom, Aunt Mimi sounds like she's drunk." I'm like, "Well, she doesn't drink." And I listened to the message, and she was slurring her words that day. And I thought, what is wrong with her? And then the next phone call I got was she had stroked.
Yeah, I mean it's tough.
It's a tough one. Is it possible to prevent a stroke?
Yeah, in fact, I think that that's probably the most important thing that we can get out to everybody today, and that is the fact that, you don't want to see me in the hospital.
No, I love talking with you, but I really don't want to see you.
So you never want to be a patient that actually sees me in the hospital because that means that you've had a stroke or you are in the process of having a stroke. And though we talk about treatments for stroke, not a lot of people qualify for them because they don't get to the hospital in time. So it's much, much more important to try to prevent the stroke from happening in the first place. So that's why, we try to tell people it's really important to keep your blood pressure under control. If you have diabetes, to get that under control. Even in this day and age, if you smoke, it's really important that you consider quitting if you haven't started thinking about quitting already. And the reason why is because once you have a stroke, a lot of times the damage is already starting to be done.
Yes, which leads me to one of my other questions is if somebody does have a stroke, are they at risk for another?
Yeah, so, if you've had a stroke, generally speaking, there's something about you, whether it's high blood pressure, diabetes, high cholesterol, that makes you prone to having stroke. And so as soon as you have had a stroke, we try very, very hard to put you on the right medication and to change your lifestyle so that you don't have another one. But still, you're going to be more likely to have another one than somebody probably who's never had a stroke to begin with.
Are those symptoms different for a second stroke?
They can be. They can be. So, one of the things is having high blood pressure damages the blood vessels.
Right.
And it could be, you've had a stroke on the left. Well, the same thing that has damaged the blood vessel on the left that caused your stroke could also be damaging the blood vessel on the right as well. So when you have high blood pressure, when you have diabetes, it damages everything inside your head. So whether you had a stroke on the right, in the front, in the back, it can all happen.
Exactly. Are we seeing a shift in an age bracket for strokes now?
Well, people are living longer.
Yes, we are.
So we definitely see more and more strokes, and we predict that in the future we're going to be seeing more and more strokes as well. But you're right, for some reason I have noticed more and more strokes in younger people as well, whether it's because they're getting to the hospital sooner because we're recognizing it, or whether they're actually because of the lifestyle they're living or something else causing an increase in the stroke itself. I'm not really sure.
Okay. We have less than a minute. What's the one thing that everybody can do to prevent a stroke?
Well, even without a doctor's help, I think we can all live a healthier lifestyle.
Yes.
And I think to a certain extent, we all kind of know what that means, because it's the same thing my doctor tells me, and that is eat better, exercise more, and lose some weight. Certainly if you smoke, you should consider stopping smoking. These are all things that we can do on our own, and I think we all have an idea of what it means. But if you don't, you can certainly go on the internet, because the internet is a great source of information for everything.
It is. Thank you so much for taking time
thank you.
out of your schedule, because as you said, there was a chance you wouldn't be able to make this, because if somebody needs you and shows up, you would be out of here. So your time is life-saving time. So thank you so much for being here.
Thank you very much for having me.
And for shedding light on something that is preventable and is the number 6 killer in Pierce County. So I just thank you for all of your knowledge and your grace.
Thank you.
My pleasure. We're going to do a little musical chairs, and when we come back after this brief message, we will have in the house, the Tacoma Police Department. You don't want to miss that. We'll be right back.